last week, before we had all the problems, you were full of righteous indignation from some of the discussions that you had.
Yeah.
So
let me see if I can rekindle this.
If you'd like to revisit
Twitter
that,
has been a source of constant annoyance to me since then. More namely the idiots on Twitter. Yes. And the idiots on Twitter, I shouldn't say all of them are idiots because a couple of them are actually my friends, but when they talk about healthcare, I'm sorry, they lose all intelligence. Mm-hmm. Here's the reason why, from best I can tell, everybody who's not a senator or a House Representatives member, here's why they support the healthcare reform: because they're sick, or because a family member is sick, and this is their lifeline because all other private insurances failed to pay for this life-saving surgery or whatever it is they need, and they think that the one and his army of angels on Capitol Hill are going to write them a beautiful bill of joy and a golden-plated victory for every sick person. Give me your poor, you're sick, and shut the hell up. Seriously, you idiots. I am not here to pay for your health care. That is not my job.
That is not your job.
I don't work your family. I have a hard enough time paying for my own family's health care. Why am I going to be forced to pay for yours? I don't even have everybody in my family covered. I haven't had health insurance for 5 years. I've been working in startups. I've just gotten to the income level the beginning of 2009 where I could get every member of my family but myself covered by health insurance, and a fairly decent health insurance policy at that. Right. That I worked my butt off to be able to afford. That is a privilege, not a right.
You got an 80-20 policy? That's what most people have. The good ones are 80-20.
Yeah, 80-20. It's getting downgraded because it's through Iris's work. Okay. It's getting downgraded through the buyout that HSBC is doing.
Okay.
But the new company is like a 70-30 or something.
Still not bad. Still not bad.
But and it's a family policy, so I'm going to actually have coverage for the first time for myself.
Well, to prove the point, can you tell me how much this family policy costs?
Well, I mean,
I'm not digging into your business. I'm just trying to help prove the point.
Well, I'm trying to I'm trying to figure out. Essentially, it's because they did some monkeying around with her pay rate so that she ends up taking home the same amount of money. She's getting paid more per hour. The plan costs more, but she's taking home the same amount. So in essence, the family plan is going to end up costing us right around, I think it was $250, $270 a month.
That's not bad
for all four of us. No, it's fantastic. Yeah. That's the equivalent. It actually costs more, but they've added to her pay rate so it absorbs the cost.
Yeah, and see, I've said this before. People need to understand that health insurance is. They say they don't have choice and stuff. Well, the truth is, health insurance is about choice. It's about your choice. The actual number of people that don't have health insurance and want it is lower than this big 30 million number that they keep throwing out there. There are a lot of people that are out there that don't want health insurance because they don't want to spend the money. They'd rather have a big screen TV or something like that. I get tired of hearing them saying there's not a lot of options out there. You can get on the internet right now, like I forget, it's called e-health insurance or something like that. And
there's 7 jillion sites for that.
Yeah, but
unending number of sites that you can go to that will compare rates and companies, dozens and dozens of sources.
And I found one that I forget. It was like just in Illinois, it was like several hundred policies from I forget how many different providers. Lots of choice, and it's cheap. It all depends on what you want to pay.
Now, I will say this. There is a sad state of affairs, and I'm not saying there needs to be regulation in this department. I'm saying this is a market opportunity. Someone needs to go out, and of course, no one's going to do it now. The government's trying to take over this business. But someone should go out there and create a Yelp-like market, like Yelp.com?
Sure.
A Yelp-like marketplace for health insurance. Because there's no way on God's green earth to tell the difference between, this plan and that plan and the other 700 plans that look just like it I don't speak insuranceese. I don't know
Right.
what half of this junk means.
Right.
I don't. All I know is the bit. Sometimes I get a big bill with this company, and sometimes I get a little bill with that company. Right. So I think we talked about this on the show before. We talked about the need for someone to translate that crap for me, and a rating system.
Yeah.
A public rating system.
Yeah. But
does the public like this company in general? What's their credit rating?
But I mean, even if you understand it or not, and not understanding it is of course bad. But just to say, there's not a lot of choices, that's just a lie.